Hello everyone, and welcome to the SOPA webinar. SOPA, S-O-P-A, stands for Settlement Online Pre-Arrival. We are a national program funded by Immigration, Refugees, and Citizenship Canada, IRCC, providing pre-arrival orientation, employment, and workplace cultural communication support for newcomers coming to Canada. My name is Echo Duan. I'm a job search strategies facilitator from SOPA, Manitoba. By engaging with our SOPA program, you can get settlement help and referrals, and develop your job search and communication skills. My colleagues and I are here to ensure that you can arrive in Manitoba better prepared, more confident, so that you can enter into the workforce more sooner. Please visit our website www.arriveprepared.com for more information. Today, our webinar will be talking about important information internationally educated nurses should be aware before arrival to better prepare your nursing career in Manitoba. I'm very glad to introduce our presenter, Bose Agbayewa. Bose came to Canada in 1977 as an internationally educated nurse from Nigeria. For 25 years, she has worked as a clinician and also a nurse manager at the Victoria Hospital in Winnipeg. Throughout her nursing career, she has been an advocate for the smooth integration for internationally educated nurses into the workforce. Let's welcome Bose.
Thank you, Echo, for that introduction. Based on my experience and that of many others who have gone through nursing registration as an IEN, internationally educated nurses who wants to register and work in Manitoba or in Canada altogether needs up-to-date pre-arrival information that will better prepare them to meet that goal. There is no national registration process in Canada. Each province has its own regulatory body and assessment process. This presentation will focus on pre-arrival information for nurses who are coming to Manitoba. The presentation will be in 4 parts. Part 1 will focus on nursing in Manitoba. Part 2, the National Nursing Assessment Service. Part 3, the importance of English. Part 4, main challenges and suggestions. We will also try and address some of the frequently asked questions by IEN who have come to Manitoba. The presentation will last about 40 minutes. Nursing in Manitoba. In many countries, there is only one kind of nurse, which is a registered nurse. In Manitoba, there are 3 different kinds of nurses: registered nurses, licensed practical nurses, registered psychiatric nurses. Nursing is a regulated profession. This means you must be registered with a nursing regulator, also called a regulatory body, to work as a nurse in Canada. In Manitoba, there are 3 different nursing regulators. The regulators are called colleges and are College of Registered Nurses of Manitoba. Their website is at www.crnm.mb.ca. College of Licensed Practical Nurses of Manitoba at www.clpnm.ca. and the College of Registered Psychiatric Nurses of Manitoba at www.crpnm.mb.ca. Your first step. There are many steps and requirements you will need to complete before you can register with a regulator and work as a nurse in Manitoba. In Canada, you may not be the same kind of nurse you were in your home country. Your first and most important step is to read the websites of the nursing regulators very carefully. The 3 nursing colleges. Many international basic nursing education programs allow IEN to apply for registration to the College of Registered Nurses of Manitoba, usually referred to as CRNM, and or to the College of Licensed Practical Nurses of Manitoba, referred to as CLPNM. The College of Licensed Practical Nurses of Manitoba and the College of Registered Nurses of Manitoba websites contain the information you need to learn about these 2 professions in Manitoba. Important notes about the College of Registered Psychiatric Nurses of Manitoba. To be eligible to apply to the College of Registered Psychiatric Nurses of Manitoba, you must have graduated from a basic psychiatric nursing education program that meets the CRPNM criteria for both theory and clinical hours. If you practice as a psychiatric or mental health nurse, you are not necessarily eligible to apply to the College of Registered Psychiatric Nurses of Manitoba because of the education program requirements. For more information, please visit the College of Registered Psychiatric Nurses of Manitoba website at www.crpnm.mb.ca. Choosing a nursing profession in Manitoba. Each of the 3 nursing regulators, the College of Licensed Practical Nurses of Manitoba, the College of Registered Nurses of Manitoba, and the College of Registered Psychiatric Nurses of Manitoba have their own list of entry-level competencies. Entry-level competencies describe nursing practice expectations needed to enter the profession for the first time in Manitoba. The lists will help you compare your education and work experience to the expectation of nurses in Manitoba. In other words, the list of entry-level competencies are like a self-assessment tool. They allow you to reflect on your nursing education and work experience and to compare with the expectations of the nurses who are entering the profession for the first time in Manitoba. Internationally educated nurses application process guides and entry-level competencies. Each nursing regulator's website has a document for IEN that provides information about eligibility and the steps you need to complete for registration. These are called a handbook or a guide, depending on the regulator. Each nursing regulator's website also has a document that presents the entry-level competencies for practice in Manitoba. Read this carefully. If you cannot find these documents on the regulator's website, contact the regulator and they will help you to locate them. Choosing a nursing profession in Canada. Things to consider. Your eligibility as defined by the nursing regulator or regulatory body. The currency of nursing education and work experience. In other words, how recent your nursing education and nursing work experience are. The current life situation and how much time you have to dedicate to the work needed to become a nurse in Canada. An example of life situation may be how much family responsibilities you have. Your goals for your nursing career. Your self-assessment results from the review of the entry-level competencies for each nursing profession. Your English language proficiency and your need to study English. Your access to information about financial resources in order to apply for assessment, study full-time, and complete other requirements. Now we're going to go to the second part, the National Nursing Assessment Service. The National Nursing Assessment Service, also referred to as NNAS. The NNAS is the first step in your application to become a nurse in Canada for all nursing professions. All IENs must apply to the National Nursing Assessment Service to have their document reviewed before applying to any Canadian nursing regulator. You cannot apply directly to a nursing regulator until you have received an advisory report from the NNAS. There are many documents you need to submit. There are many timelines you need to know about. It is important to read the NNAS Applicant Handbook and the frequently asked questions carefully. Things to consider. You must read and understand the information and instruction in the NNAS Applicant Handbook and frequently asked questions. Download these from the How to Apply section on www.nnas.ca. If you do not understand the information in the NNAS Handbook, do not begin the process. You must complete the application yourself. Do not have anyone else complete your application for you. Do not start the application process with NNAS until you are able to present all the required documents, including proof of English language proficiency. Things to consider continued. If you apply too soon, your application can expire and you may have to pay additional fees to keep your file open. English language test results must be no more than 6 months old when you submit them to the NNAS. You need a plan to ensure you maintain proficiency in English. Before you emigrate, inform your School of Nursing, your nursing employer or employers if you have more than one employer, and registering body that they will need to send documents to NNAS when you are ready to apply. You are responsible for paying any fees required to complete these forms, including translation costs. Part 3, the importance of English. English language requirements. The ability to communicate well in English is the most important requirement besides your nursing education and nursing work experience. You must take a language proficiency test if English is not your first language. You must submit English language proficiency test results to the NNAS as part of your application. The NNAS only accepts 2 kinds of English language tests: IELTS, International Education Language Testing System, at www.ielts.org. Only the academic format is accepted. The second acceptable language test is SOPA, Canadian English Language Benchmark Assessment for Nurses. For more information, you can go to www.selbancenter.ca. Selban is only available in Canada. English and communication. English language proficiency does not end with successful English language test results. Communication is a primary activity of nurses. The ability to communicate well and understand the needs of patients and their families, clients, and co-workers is a primary responsibility. Development of English and communication skills is part of lifelong continuing education. It is important to know that you may still need to upgrade your English to meet language requirements, even if you think you are fluent in English. Manitoba has a number of free English language classes and programs that focus on language and communication in healthcare. English and communication continued. The Canadian Culture and Communication for Nurses program is an online program that is available to you even before you arrive in Canada. For more information and to register, go to https://cccn.manitobanurses.ca. Again, https://cccn.manitobanurses.ca. Part 4 and the final part. Main challenges and suggestions. Main challenges to becoming a nurse in Canada. English language proficiency. Balancing the urgent need to work with the time and effort needed to become recognized and able to work as a nurse. Balancing settlement and family needs with the effort and financial resources needed to become recognized and able to work as a nurse. Making assumptions and making decisions too quickly, not doing enough research. Using a college advice from others who means well about the profession in Manitoba or the regulator's current process. Applying to the NNAS too soon. It takes to prepare and to complete all the requirements. The cost of missions, required documents, assessment, and bridge training. Staying motivated when there is so much to do and it takes so long. Loss of nursing skills and knowledge because of time away from nursing practice. The Canadian healthcare system likely functions differently than the system you are working in. If you want to work as a nurse in Canada, you must make sure working as a nurse in Canada is your main priority. Be responsible for your career decision and your future. Be realistic about what you want to achieve and what it will cost in time and resources. Be prepared for the many financial costs. Be prepared to dedicate your time to learning English. Be patient and know it will take time. Be engaged in your process and be prepared to study for bridge training and/or national exams. Be honest with yourself about your commitments and ability to do what it will take to succeed. It is challenging to get through the process to become a nurse in Manitoba, but it is rewarding and worth it. Good luck.
Thank you, Bose, for this wonderful and informative presentation. There are 4 questions that I frequently receive. Hear your answers on them. If I'm registered with a nursing regulator in one province, is the transferable across provinces?
Yes. Once you've been registered in one province, your registration is transferable, which means you can practice. In some cases, there may be some additional requirements.
Okay, thank you. And the second one, Is it just easier to take the nursing education in Canada to continue my nurse profession?
Not necessarily, and I will tell you why. Through the regulator's website, information about eligibility, you've reviewed the entry-level competencies, you've reviewed the registration process, and you feel confident that you can go through the registration process. My advice would be to go through the IEN registration process. In some cases, basic nursing education may still be required. It's important to note
so it depends
that the application for admission into the basic nursing education program is also very competitive.
Okay, so it depends on your individual situation. Okay, the third question. Are there nurse-related job opportunities outside Winnipeg?
Yes, if you are able to move province, there are lots of jobs out of Winnipeg. Yes.
Okay. Final one. What are the financial assistance programs or aids that can help me in financing my licensing process?
There are two major organizations who can assist you with financial assistance. One is Employment Manitoba, and two, recognition. You will need to be in Manitoba or you can access this financial assistance.
Okay. Thank you again, Bose, for this wonderful presentation and also putting all the information together for internationally educated nurses prepare their job transition in Manitoba, which is very helpful. And also, thank you for watching our webinar today. We're going to have more webinars coming talking about different regulated professions in Manitoba. Please stay tuned. If you have any questions, please do not hesitate to connect with us. Our connect information is on the screen. You can write to us by sopa@amimanitoba.com or you can give us a call. That is 204-944-0133. Okay, thank you so much for watching. Hope to have you soon. Bye.
Thank you.